Hello, I'm Rob Bowie, Executive Vice President at Brightree, and I'd like to thank you for joining today's Brightree Coffee Talk, where we're excited to welcome Patty Mastandria, CEO from MedCare Equipment Company, and Casey Tumagen, CEO from Hometown Healthcare, to get some insights on their experiences during this pandemic. Before we begin, I want to cover a few quick housekeeping items. This webinar is being recorded, and we will email you a link after this session. If any questions come up throughout the conversation, please feel free to enter them into the questions pane in the GoToWebinar control panel on your screen. Due to the volume of attendees on this call, we will follow up directly with your answers. So let's jump right in. Welcome, Patty and Casey. Good to have you.
Good morning, Rob. How are you?
Morning, Rob. Thanks for having us.
Well, we appreciate you being on. So I'm going to start, Patty, with you. Briefly tell me a little about MedCare Equipment Company and your employees, products, markets you serve.
Absolutely. And again, Rob, thank you for having us. So MedCare Equipment Company is a full-service durable medical equipment company located in Western Pennsylvania. What makes MedCare unique is we are a hospital-based DME owned by 8 different health systems here in Western Pennsylvania. We have 7 distribution centers, 5 retail stores, over 330 employees. We did a joint venture with another health system in the eastern part of Pennsylvania 3 years ago to see the diversity between the state. It's been very challenging to see how the pandemic has affected the western part of the state versus the eastern, which I'll speak upon here in a few minutes. Another thing that makes MedCare very diverse is we also have a long-term care distribution business where we try to participate with the physician offices on their office supplies. We do long-term care distribution to the skilled facilities, long-term care facilities, personal care homes, etc. We sell consumer directly to the patients, and then we also provide the durable med. We do everything but complex rehab. Our specialty is the respiratory programs. We do everything from nebulizers to oxygen tanks to ventilators. So we're pretty complex. We take a lot of pride in managing the continuum of care and disease management with our owner hospitals and our referral sources. I've been with MedCare over 20 years, so I'm proud to say this was an experience, but I've learned a lot from it, and it will make us stronger, and I think it's going to help the whole DME industry with what the payers have done and the respect for the products and the services we provide.
Yeah, and thanks for that, Patty. I couldn't agree more. I think that out of this pandemic, I hope that the whole health system sees how important the HME industry is in the overall care continuum, and truly it's been just a pleasure and humbling to see the way you providers have stepped up. So we certainly appreciate that. Casey, tell us a little about your organization.
Sure, and again, thanks for having me, Rob. Thanks for having us. I'm CEO, as it says, over Hometown Healthcare. We are a 35 employee organization that focuses on respiratory home medical equipment, and recently we added onto that respiratory care management, and we really want to, we have a saying internally at Hometown Healthcare that we want to make sure patients are really working their therapy, and on the back end that their therapy is working. And so just following up with them and using remote patient monitoring to make sure their adherence is there and make sure that the outcomes that are in the physician's plan of care are being met and managed to. We're based up in Clifton Park, New York, which is 2.5 hours, maybe 3 hours north of New York City, near the Albany, New York area. We have 2 locations, our main headquarters where our home medical equipment organization is, and then about 20 minutes south, we have a local retail pharmacy. And we're locally family owned and operated.
Great. Well, I appreciate that, and Casey, and I know that sounds like you cover some of the rural area of New York as opposed to maybe New York City, et cetera. So we're very excited to have you on and get your perspective of how this pandemic has affected your company, your referral sources, and your patients. So that's great.
Yeah.
I'm going to start, Casey, I'm going to start with you. So we are 3+ months into this now, into this pandemic, and what have been your biggest surprises due to COVID-19?
I think the biggest surprise, hands down, is for us how we have not had very much of an impact at all. We have not supported one COVID patient in our patient base. And that probably surprises a lot of people because they think of New York and all the attention New York City got with not having enough capacity or the capacity issues they were dealing with and how hard they got hit. But in our area, the censuses of the hospitals remained really low. Most folks were not going to the hospital unless they were really sick or had COVID. And I think that allowed those hospitals to keep those patients admitted until they were fully better. So our situation was not that we had to support COVID discharges like I thought it was going to be. It was that really we were being asked of the hospitals to provide them with medical equipment, and we did that so they could support their inpatient folks. I found out that they really haven't even had to use that though. So just a tale of two cities in terms of what the New York City area has dealt with and what the capital region of New York has dealt with. So I think that's surprise one. Surprise two has to do with an internal assessment, just our team and their ability to be adaptive to this crazy situation, being pushed off site. 70% of our HME workforce being moved off site and being able to handle that really, really well with an amazing attitude. So those two surprises, two really interesting things that happened from this.
Yep. So, and I'll turn that to you, Patty, because we've had conversations in the past, and I know that you have had COVID-19 patients under your care. But as I look to you, what were the biggest challenges, or not what still are challenges maybe for you? Let's talk about that as opposed to surprises. What are some of the challenges that this still presents for you?
So again, being hospital-based, and we have over 50 hospitals that fall under our ownership from the health systems. And it all started, the awareness, it broke on March 15th, and it was how are we going to react and what are you going to do for us? And COVID was new to everyone and no one knew what to do, nor was everyone really prepared. So the first challenge was making sure that we had enough PPE for our staff to protect them, and then we had to develop a plan on how we were going to do that. But the hospitals that have ownership into MedCare were like, are you going to, still have your liaisons in the hospital? And we removed them immediately on the 16th. How are we going to get our supplies? Which means oxygen to the room to expedite discharges. So how are you, MedCare, going to help us manage our patient care and all the goals we have when it was so fresh? And we started suddenly realizing that we had a lot of relationships that we could really partner with and say, what do you need and how can we all work together? So the relationship of, can you provide nebulizers on consignment versus having your staff bring them in? Can you do doc delivery? Can you help educate our team? We started all working together more as a team than we ever had, because one of the barriers we have as a DME is always the documentation you need is so difficult. We just want these patients out the door. Philosophy totally changes how we can work better to protect the employees and better patient outcomes. Census in our area dropped dramatically. We've seen a reduction in the patients coming into the ERs, which we do a lot of mobility items out of there, so that all dropped. Visitors stopped coming to the hospital because the guidelines of the hospital saying one visitor, then no visitors. But the biggest thing is, how do we treat these patients that are going to a hospital or a site that could be potential on COVID? And how do we get the equipment they need at home to protect them? Non-COVID patients, we wanted them in and out quickly. COVID patients we did admit, but then we needed to get them home. we had 60 patients under service that were positive COVID from the time the pandemic started. So from March 15th to last week, we had 16. Only one in the last 2 weeks. And what impressed me the most was, and we reallocated a lot of our staff to home. A lot of the billing went home to work, and a lot of the customer service, we were able to have them work remotely. Our drivers, where a lot of times they don't get recognized of everything they really do, and they stepped up, and they're like, we are going to do this. We are not afraid. Provide us the protective wear. We are going to take care of our patients. And the unity that came out of this between all the different referral sources, the patients, have been unbelievable. With virtual setups, patients feel that 1 hour setup, it's one-on-one, they're getting more out of it, and they welcome that. And they don't want to go out. And we are getting more and more letters written from patients now complimenting us on our service than we ever did.
Yeah, and I talked to other providers throughout the country, and they echo the same thing, that this has brought the referral source and HME industry together in a way that it hasn't been in the past, and that only, you know, could bode well for us as we move forward. And I know we all hope that CMS and others are seeing how well the HME industry is working with the referral sources, whether health systems or physicians, and taking care of these patients, because it really needs to be noticed, and things do need to change to make this as smooth as it has been for a lot of providers, and getting the appropriate products to these patients and caring for them. So that's just fantastic.
Well, one thing I want to mention is I have had many conversations, one of our biggest payers here in Western Pennsylvania, and the medical directors. And I will tell you, I do believe they recognize it. I absolutely do. They have called to say, how can we change the documentation requirements to service the beneficiaries? Because through this whole thing, they didn't want any delay in care. So when you look at the payer's guidelines, just to provide wound care, and how home health has to be involved to make sure that they're seeing progress in the care that they're providing to continue to provide wound care, and measurements need to be done. The whole change to telehealth has been very positive. Getting documentation can be challenging. They're totally aware of that. They realize we are only a piece, and a small piece, of what is needed. And without that documentation that's required from someone else, they've pretty much said, you're really limited. And that's very positive for us, that we've developed that stronger relationship with payers, because now they're coming and saying, how can you prevent any interruption? How can you get this patient equipment timely? And when you talk about nebulizers, we're providing just the piece of equipment to be the transmission to get them the therapy they need. They still need the med. So I do think this particular payer, if this is a sign that they're all going to recognize it, it's going to be really good for DME.
Yep, no, that's great, and I 100% agree with you. Casey, as you look at when this hit, you know, obviously you had to look at how you were going to leverage new technology, and how that was going to not only assist your patients, but using technology for your employees. Sort of walk us through that, what you're doing now, and what you've implemented, because you're a different size organization than Patty, and I'm very curious to how you're now leveraging new technology approaches to take care of patients and your employees also.
Yeah, well, fortunately, we in November, coincidentally, we had switched to a Google platform. We had gone from sort of a server-based platform for email and communication, calendar management, to this Google platform. And Google has provided us with some incredible digital tools that we weren't planning on rolling out, but when COVID hit and we had to push staff off-site, having access to those really allowed us to stay connected with our staff, and whether it was having a Google Meet meeting, or the chat features that Google provides, or an impromptu sort of Google meeting that wasn't necessarily scheduled, just being able to pop in, kind of emulating what would have been just kind of showing up at somebody's office for a quick conversation. Google kind of provided a lot of those tools, and getting people to use those tools was really adopted well. And I think had COVID not happened, it would have been a much longer learning curve or adoption curve for that. So that's one piece. We did not have, though, a VoIP system. So one of the technology pieces we had to have is installing an internet phone system. So we picked folks that were working from home had the same functionality that they would have if they were on site. And so that was clunky for a while. But last week, happy to report, we got that done, and that's been technology. Some basic just communication things there. On the patient-facing side, we still are seeing folks in our building, but the building is locked down. So the very first technology piece we've leveraged is one of those video doorbell, Ring doorbell pieces outside, so we can talk to the patient, see the patient, go through some screening with them. So I guess that's a little hardware technology thing that we were using with some software on the computer to talk to them and see them, to screen folks before they come in. The other piece is really trying to solve the problem of how do we minimize patient contact in a world where contact has been such a part of what, how this has run, how this has worked so well. From doing a mask fitting, it's hard to do a really good mask fitting if you can't touch somebody, but we also have to minimize the spread of infection. So we decided to implement a virtual PAP process where we are giving folks the option to have the CPAP or bilevel shipped to them, and then for there we're using a Google Meet feature to do the actual teach and patient education. On top of that, I mean, we've always had this in place, but leveraging remote monitoring technology to make sure that they're actually, their care is being managed. They're actually adhering to the therapy and that the therapy is actually working the way it's supposed to. That was in place and continues to be in place, leveraging the ResMed's AirView and U-Sleep platforms, which integrates really, really well with Brightree. Continuing to use those tools to drive outcomes has been a big thing. The one thing we're looking forward to just rolling out, which isn't quite rolled out yet, is with respect to the virtual PAP and the remote sort of delivery, is the electronic signature, electronic paperwork documentation with signatures and dates. And that's not rolled out yet, but we've been actually working with Brightree to talk about what our wish list would be for something like that, and some technology that actually lives already within the MyForms platform. We're looking forward to seeing how that gets built out so we can leverage that. So those are just a little bit of the things that we're doing to leverage technology at Hometown.
Great. And Patty, I'll pose the same question to you. Is looking at the technology that you have, what really have you leveraged in with regards to patient care and working with your referrals?
Okay, thank you. MedCare has not opened. We closed all our retail sites and closed all our administrative offices to the outside world. And our therapists literally stopped doing home setups. We stopped doing preventative maintenance. We stopped doing portable oxygen concentrator evaluations and PMs on vents. May 18th, we did open our 3 retail sites for patients to come in, one patient at a time. They have to call when they arrive to get their portable oxygen concentrator evaluation. And we did start sending therapists to homes, but only for vent follow-up visits and PMs. We anticipate in August we'll start doing PMs on concentrators again. But where did we leverage technology? Is we had all the technology in place for the phones and for people to go home and work. It was monitoring their activity, because working from home isn't for everyone. So we had to make sure that we had tools in place that they were taking the number of calls, the calls were being converted into orders, and they were keeping up with all their tasks. So that was very challenging for some of the managers to manage their staff that were working remotely, and how to address the staff that did not have the time management skills to be able to multitask. But we worked through all that. We provided them tools and resources and let them know that we were here remotely. So we did a lot with Teams. We did a lot of virtual education, more so on products when we had downtime. and we really enhanced the process and policies and made sure all the employees knew that.
Casey, as you think about your business and how you're taking care of patients and your referral sources and your employees, talk to me a little about maybe the largest challenge you're still facing.
Yeah, the biggest challenge for us, without question, is the sourcing of product, specifically oxygen concentrators and vents. Probably the largest concern out of the two right now for us is concentrators, because we had recently deployed a new vent program, or the vent line itself, and so we didn't have a ton of patients yet. But the oxygen concentrators, we have several hundred, almost 800 active patients. And fortunately, we've had really great support from a local hospital-owned DME that's allowed us to use some, and another HME a little bit farther away that we bought some from. But we're still being told it's in August or 14 weeks out before the manufacturers can get us product. And just kind of an interesting, little too tight for comfort scenario for us.
Patty, I'll turn to you. What learnings have you had that will carry on when we return to that new normal? Specifically think about how you'll leverage technology with referrals, with your patients, and even with your employees. Sort of talk what that new normal is going to look like for MedCare.
So our new normal, and we started implementing it, we will not go back to having clinics. We feel it would be very irresponsible for us to put our employees at risk and the patient at risk by trying on different masks. We have no white paper that says there's any good way to decontaminate that item. So we'll continue to provide tools and resources to our staff and also to the patients by using AirView U-Sleep to ensure they're getting compliance. We're going to engage the payers on a flow chart of when we engage the physician and the sleep lab on what ownership we feel they should have in, especially with fitting of the mask. And we're going to provide the patients tools that remotely they can fit by measuring across their nose, the bridge of the nose down to the chin, to ensure that we are providing the right product out of the gate for A, fit, B, comfort, enhance their compliance, to make sure that we are providing the therapy the patients want out of the gate the first time. Regarding in-home delivery, we hope to continue to do porch delivery versus in-house delivery and enhance our education available through virtual. We found patients are more comfortable with us delivering to the porch versus coming in. It's a scary environment for patients to let strangers into their home. They don't know what they're expecting when they go home with new equipment. So we found that to be very beneficial. We don't know the future of our retail. That's something that our new normal we're trying to figure out. Do we see patients coming back? How do we handle retail? Would we be better just to make it a focus on what we do best, and that's our clinical? So that's some of the points we're still talking about. But we're working with our referral sources of how we can be part of the continuum of care and communicate electronically to let them know the success we've had with virtual setups, with the education we're providing on compliance, getting them the best mask fit in a safe environment.
Yeah, and I really think there's a lot of ways, and you both have talked about how we will work closer with our referral sources and what this has done. So I think with all the challenges, with all the tragedy that has come out of this, I think there's going to be some great learnings and some great new ways that we do business with our referral sources, with our patients, and even with our employees. I think that we didn't touch on that necessarily, but I think a lot of people are seeing how well and effective, if you have the proper technology in place, that really you can operate as a business from your home. So that's great. Well, listen, I want to thank the two of you. It was I knew it would be insightful, and we really have two different business models, two different sizes, but both very critical to the industry and what you do. So to Patty and to Casey, thanks so much for joining.
Oh, thank you for having us.
Thanks for having us, Rob.
Good. I want to close with a reminder that we're continually updating tools like Brighttree.com's Coronavirus Resource Center, and sharing provider feedback to the COVID community discussion group. You know, what we've heard resoundingly from this industry is that if you're having challenges, you need to reach out to your colleagues. We're doing our best to provide forums like these to facilitate peer feedback, and if you haven't already, I encourage you to check them out. Also, if you haven't claimed your access to the COVID-19 Impact Analytics Dashboard, please reach out to get set up with this resource, now available to our customers at no additional cost. Please do check that out. And with that, I'd like to thank everyone for joining the webinar today. If you've asked any questions throughout the session, we'll be responding directly. And if there's anything else you'd like to reach out to, feel free to indicate on the post-webinar survey. I'm sure that Patty and Casey will work with them to respond to any specific questions that you have directly to them. As a reminder, a link to the webinar recording will be sent to your inbox, and you'll be able to review the presentation again. We will also post this in community.